Hi, I'm Zak Drake for CANXL, and welcome to Trainer Spotlight, where we connect with top professionals in the soccer industry to uncover tips, tactics, and tools to help you build a thriving soccer business that supports the next generation of players. Today, I'm joined by Dr. Merrie Leung, a chiropractor, coach, and musician who leads Fine-Tuned Health and Performance in Toronto. With a background in competitive sports and music performance, Dr. AM specializes in injury prevention, concussion management, and sport-specific rehab. Her unique blend of experience offers valuable insights for trainers, helping to support athletes holistically. Merrie, welcome.
Thanks for having me.
Yeah, really happy to have you here. First off, I'm a sucker for puns and double entendres, so I love the double meaning of fine-tuned health and performance. So with your music background and the imagery of getting your health and performance to a state like a fine-tuned instrument, did you come up with that one yourself, or how did that come about?
Yeah, I was trying to find the most punny thing I could, because a lot of my soccer players are also like, they were like, oh, fine-tune your touch, or like fine-tune your body, like chiro, and like fine-tune music-wise. So it was a nice little word play that I could have used for all the three things that I love.
Yeah, I really love it. All right. So you've had quite a journey from playing competitive soccer to studying music performance at McGill and U of T. How did these experiences shape your approach to injury prevention and rehab?
I think it's definitely given me a unique perspective, just seeing it from all the different sides as like a former athlete and then also coaching for many years and from the music side as well. It just gives me a different perspective, like I said, just seeing things as a health practitioner as well. It's interesting, I found like growing up playing sports, when you have an injury, a lot of health professionals tend to just tell you to rest. And for me, that was never really an option with soccer or with music. You just want to play, you want to do your thing. But on the other side, you know, if you're training, they tend to just tell you to play through it. And so I think I have a nice balance between understanding what it is that, you know, athletes are looking for and trainers are looking for from the coach perspective as well. But at the same time, balancing and making sure that athletes are staying healthy, that they're, you know, the longevity of their careers are not just worth playing one extra game kind of thing. So I think it's a nice blend that I get to work with.
Good answer. So how do you integrate your understanding of both athletic and artistic performance into your practice today?
I think it's more, I mean, I've applied the artistic stuff the same way that athletes treat their bodies and the way that athletes train. I think the perspective from the artistic side has also given me more depth of, you know, the training that comes behind mastering a skill for me and an art is very similar to what it is on the athlete side. And so, yeah, it kind of blends both of those things.
Yeah, that's awesome. So concussions are a significant concern in soccer, and I have some parents request no headers during our private sessions. What are your thoughts on that, given your personal experiences and specialized education in concussion management?
I think it really depends on the age of the player and how early we're starting headers. I know for myself, I started pretty young, and I think knowing the technique for how to do a header is very important if that's something you're going to do in a game. In terms of like recovery, and if they have recently been concussed and they don't want to do a header, like that definitely is something to keep into consideration and talk to their healthcare provider about. So I think if you're doing one-on-one training, for example, my personal recommendation wouldn't be, and I'm sure trainers aren't really doing this, like 30 minutes of just headers, like things like that I think people use general common sense and are not, you know, that's not their go-to. I think the biggest risk of concussion with headers is not so much like them actually heading the ball. It's like when you go up for a header and you make contact with someone else, or if you land weirdly, or, you know, head-on-head contact, that kind of thing. So I do think like proper training and education on how to do a header is important to help prevent them from happening. But at the same time, like I said, I think some of them starting depending on the age, like there's no like magic age I personally would say of when to start. But I think, you know, not starting with when it's middle of winter and the ball is like frozen and you're just doing repeated headers is not recommended, but at least having the technique, you know, I think for me personally as a coach as well, if parents aren't comfortable with it, then I don't do it. That's their choice. But I also know if the goal is to be a high level player, if you can't head the ball, that's part of the game as well. So I think it's a balance that you have to find.
Yeah, for sure. And I think one point that you brought up is really important, how to protect yourself, like when you're going up for those headers against other individuals. Personally, I've been on the receiving end of head collisions. There was two seasons ago, I actually split this eyebrow, and then about a month later split this eyebrow as well. So it's a bit of a do as I say, not as I do situation for me, but I do train players in, getting their arms up to protect and create that kind of barrier, just to add that extra level of protection. But again, it's also the environment and the level that you want to play at. performing skills highly. Like, I have another memory of playing professionally in Las Vegas, and the training session for the defensive line was literally just a goalkeeper booting the ball up and us needing to clear it out as hard as we can. And after a few reps of that, there's almost this sense of like, all right, I'm a little bit like, I've done enough. Let me maybe miss the ball the next one just to protect myself. But yeah, as coaches, I think it's important to make sure that we're protecting the precious brain that is, so soft in this hard case.
I mean, and for me, like myself, like with my own personal experience, like I've had 15 concussions, which is too many. And so like for the last, I don't know, probably 4 or 5 seasons that I have played, probably should not be playing anymore. Like you said, do as I say, not as I do. I do wear a Petter check helmet, and the evidence shows that that's not going to prevent a concussion from happening. And I know that. I just have that there for myself as like it absorbs some of the force. If the ball does hit me, every time when I am playing, if the ball comes, my teammates yell, "Don't head it." And I'm like, but if it's a corner and I need to clear it, I'm not just going to let them score. Like that kind of thing when you're playing, you don't think about. But at the same time, I know how to do a header at least, so it feels safer than just not knowing. And, if the ball hits you, it's a lot worse than you actually making contact the way you should.
For sure. And you mentioned, okay, if, a player is recovering from a concussion, maybe don't focus on headers, but what other strategies would you employ to help athletes recover safely and effectively?
I think it's really important to make sure you're monitoring the athlete as they're training, because they could feel great one day and then the next day not feeling so great. The important thing with concussion management is to make sure that your athlete's always progressing upwards. Like you don't want them to feel really good, then come train really hard and then it dips back down. Then they're like, oh, I can't do this tomorrow. You kind of want to make sure that you go from they're feeling, you start from low intensity kind of cardio stuff and slowly increase that before you start to introduce things like harder stimulus of like visual cues or auditory cues and then contact and things like that before you throw them into more challenging things. I think it's important too, like if they're not feeling great and they have a headache, probably not the day to train kind of thing as well. And just to be flexible with them through their recovery and to make sure, because like you said, the brain is very important, and we don't want to be compromising them at all in their future. And a lot of times they might feel really good, and it might be a week or two, and they might not even tell you. And that's the hardest part, is if they athletes want to play, and so they probably won't tell you even if they're not feeling great. And so I think as a coach or as a trainer, especially if you know your athlete and you know the individual, if you can see that they're a little bit off, then for me, it's not worth the risk at all to push them past that, because you can see that there's something that's going on with them.
Yeah, absolutely. There's a level of responsibility for coaches or people in that authority position to take care of players. And as a private trainer, communication with those players, sometimes I have even quiet players that I need to ask them questions and get information out of them. So developing that as a skill and making sure that you're taking responsibility for those types of things doesn't just have to be concussion, but how are they feeling? What's their energy level, their fatigue level? Did they just play a game that maybe you shouldn't be making them do sprints? Things of that nature. So I really like the idea of monitoring. It's a really good one, not just for, say, athletic therapists, but anyone who's supporting the player's development.
And I've worked with enough coaches too over the last few years, just seeing like sometimes athletes don't know that they have a concussion. I know myself, when especially early on, you just play, you take a weird hit, you fall down, and you're like, I'm probably fine. And your coach like may or may not even take you off. You might just run it off, and you're like, the goalie booted the ball really hard. I headed the ball, then I took a weird hit. It's just part of the game. But when you see if they get up really disoriented, like if you start to notice that there's like behavioral changes, and especially like you said, energy levels, like things that don't really make sense, I think it's important to either, if you know what to do with them, or at least to refer them to someone who can properly assess them to make sure that they're not putting their health in jeopardy by continuing to play. I think that that's really important.
All right. Injury prevention in general is crucial for athlete longevity. So what are some common patterns or risk factors that you observe in athletes, and how do you address them?
I think the biggest one is overtraining, is the one that I've seen the most recently. Usually like beginning of the season to end of the season, when it overlaps with school for a lot of the kids, when they're doing like track and cross country and school soccer and their regular stuff, and there's just too much going on, is usually when I tend to see a lot of the injuries pop up. They're just not managing their load effectively. They're not sleeping enough. They're not fueling enough. And all of those things compound into like overtraining, with all those things that their bodies can't handle at the same time. And then just as well, like the biomechanical dysfunctions that I've seen, like trainers and coaches see it, you see the players that move in an awkward way, but they can do the things they need to do. But I think catching that early enough, or when you do notice it, like helping them work on their technique, helping them work on how their body movements, like normal athletic movements, really plays a big role in preventing some of those injuries. And then lastly, I would say, especially with some of the younger players, but even as they age, the ones that like throw their bodies everywhere, those are the ones really early on that I see as they get older. If no one kind of addresses that, that's one of the biggest injury prevention things I think we can work on is, like I said before, just teaching athletes to use their bodies properly. I don't know if properly is the right word, but in a safer way for them and for other athletes so that they don't end up hurting themselves or someone else.
Yeah, for sure. Like one player I have in mind that really lunges in a lot, whether it's a lunge to shoot or a lunge to, block or have a challenge, and getting into those types of body positions definitely increases risk of something happening, especially because they're off balance and things like that. Can you share any specific warm-up routines or exercises that are maybe outside of the traditional exercises that you enjoy that are effective in reducing injury risk?
I have like a routine that I usually do recommend, and it looks very similar to most kind of soccer warm-up routines. And it's like not a specific one to share with you, but I think for me, it's just making sure that during your warm-up that you cover like all of the movements that you might possibly do in a training session or in a game, but in a dynamic way so that you're actually warm when you are like at the end of your warm up, you should feel warm. It's not just like I ran the bunch of cones and I opened the gates a few times and I kicked and now I'm ready to play. It's like you should feel warm, like after the first 10, 15 minutes of you playing kind of warm. And that if you were to like kick a ball as hard as you can, if you were to explode into a sprint, that you've done that movement pattern. But I would I start it and then gradually increase that, whether it is, like I said, like kicking, whether it's lunging in for a ball like that player you mentioned, whether it's, I don't know if that makes sense, but making sure that you kind of tackle every single movement that you might be doing and making sure that we're dynamically moving through that so that your muscles warm up appropriately in that range before you really challenge them in the game.
Yeah, absolutely. So lots of like jump and lands, or at least like leg swings to mimic kicking, things like that, or actually, kicking a ball during warm up. Yeah, I like that. There's one, I actually haven't looked up the research of it, but I believe it's called PRP or something like that. But our strength and conditioning coach at Alliance, he's also with U of T. He has us do this thing during warm up, and it's like rubbing certain areas of your body, like here, your rib cage, your hips, certain areas, and apparently that has some activation thing. I'm not sure. I need to look at the literature first, but it's an interesting one. And if nothing else, I love a good placebo effect.
I mean, I can't knock it because I don't know, I haven't heard of it, but if it works and it's not harming you, I'd go for it.
Nice. Okay. So I try to train players on natural grass whenever possible, but obviously turf is everywhere now, especially here in Canada with the climate. So I've personally seen a few bad injuries on artificial turf, including a teammate this season that just tore his ACL while wearing firm ground boots on turf. So from your perspective, what are the real risks of turf surfaces compared to natural grass? And how much do you think things like footwear choice actually impact injury risk?
So I'm going to start this by saying that I haven't read the literature on this. This is just my personal opinion and not my professional opinion, if that makes sense. But I would say that like you, I've seen too many ACL tears on artificial turf. Obviously, I have seen some on grass as well, but I've seen way more on artificial turf than I have on grass. I personally prefer to train and play on grass than to play on artificial turf. And then footwear-wise, what I've recommended to a lot of my athletes as a coach, not so much as a healthcare professional, and myself, is that I think the firm, like you said, firm ground boots on turf is where I've usually seen the most injuries, at least from my perspective. And so I recommend artificial grass boots if they can, whether it's the studs or the little ones or the full length ones, but meant for that surface. Same thing as wearing your firm ground boots on firm ground grass, and then same thing in an indoor season kind of thing. But that's what I would recommend. I carry 3 pairs of shoes with me every time I play, and depending on the surface, I test it out during warm up. And if I'm slipping or if it's sticking, then I'll switch my shoes just for my own safety. And for, if I make contact with someone else, same kind of thing.
Nice. Yeah, I appreciate those recommendations. And I myself as a player fell victim to this is what I've always worn, so why would I wear something else? But in seeing the injury this season, there's this thought in the back of my mind, okay, yeah, I think it's time to invest in having multiple different types of pairs instead of just one pair. And I have a prop here now, literally just because they're beside me, but I just bought new boots, and unfortunately they are not artificial grass boots, but they are beautiful. And, it's hard to knock a nice pair of boots when you want something that looks good. Yeah, I think the suggestion for players or parents, buying boots for their kids now is it's worth the investment, especially I believe, maybe you could correct me if I'm wrong, but female athletes are more at risk of ACL tears. Is that correct?
It's the number of females with ACL. Yeah, basically, yes.
Okay.
The simplified version is yes. And I've played at a decent level, and we knock on things of like how many people on the team have an ACL. Like, it's not a fun joke, but the fact that it is one is like there's so many. And so it is a mix. To me, it's like a strength and conditioning thing. It's a risk factor thing, like the turf. There's all these different things that play a role, and those are beautiful boots. And it is sad that I understand that, but to me, like I usually will tell parents too, like if you get a pair of artificial turf ones, you can use them in indoor season as well. So it's not like it's only for summer or only for a certain surface. And obviously it's easier when they're not growing anymore too, but when it's like a trade-off. It depends how much you're playing. It depends how much you're training. Like, there's all these things that depend. So, but if, a lot of them are training so much now that you're like, if there was an injury, the cost of you dealing with that afterwards is more than the extra pair of shoes.
Exactly. Yeah, I think that's a good one. And I'm going to take that away for my suggestions to parents. It's the investment side of things, the trade-off. Either you're paying for it now or later, who knows? But yeah, that's a good one. All right. Your clinic offers a range of services from chiropractic care to sport taping and cupping. How do you determine which modalities are appropriate for each athlete?
As a chiropractor, I usually will assess each athlete individually as they come in, see what stuff is going on for them. And then it's really patient-centered care. So it's seeing what they need. We talked about, some biomechanical issues that I've seen in a lot of athletes in the past. So whether it is like figuring out what kind of exercises they need, working with a personal trainer one-on-one with them so that I can see what kind of stuff they need to work on. If it's more like some of the sports taping, a lot of like return to injury after ankle sprains, knee injuries. It's getting them back on the field as soon as I can, but in a healthy way. So it's incorporating some of that. I have a very rehab and exercise-based practice. So there is hands-on care that I use to help athletes get better. But mostly it is, how do we get stronger so that we can get back to doing the things that we need to do? And specific to soccer, or for me, at least with the soccer players, is, how do you incorporate some of those things into the movements they'll need so that they can do the things they need to do on the field? Are
there any tools or techniques that maybe private trainers could use to help their players that you find particularly effective?
It's a good question.
I know you mentioned that you're pretty hyper individualized, like it's what that specific athlete needs, but just in you sharing previously that, strength and conditioning for female players could be a factor. I'm wondering if, that could be an area that as a takeaway for training female athletes to maybe focus a little bit more on strengthening.
I definitely think that that's a big role. I know there's a lot of like focus on technical stuff. And I used to be mostly focused on like a lot of technical training, but I think like we mentioned earlier as well, like I said, if you see that if a player's trying to take a shot and it looks weird, like there's like within the plant and they can't get the force they need, then it, like I said, it could be a strength issue. If you're seeing that if they do a squat and their knees cave in, that's probably why they're having issues with a certain thing. Or if you're trying to, I don't know if that makes sense. And so if you're trying to work on things in one-on-one training, part of it might be addressing some of the weaknesses. It's really common in especially female athletes, is all athletes in general, but just like a lot of like lateral glute stability, a lot of like glute strengthening, a lot of like hamstring stuff, like things that I guess, for me, I was like, this is, for me, common sense stuff that I work with every day. But for a regular trainer, that's where I would look at to see what their movements look like and if that's something that you can help train them as well, because I think that will help get the best results for you in their training as well.
Nice, I like that. And yeah, the fine tuning of like the body mechanics for let's say shot power or like shooting technique can only get you so far. And once they have that down, if they want to improve beyond that, then I think that's where the strengthening really comes into play. For some of my players, I do work on getting their shot technique. And I have one player that we actually measured, and when he started, it was like 14 miles an hour. He's just a young kid, 14 miles an hour, and then we fixed up his mechanics of it, and he got up to 30 miles an hour. And I'm just thinking, okay, so if he wants to improve beyond that, well, what can we do? The natural thing is it's not just repetitions. You got to build the muscles up to get a little bit more force generation there.
Exactly. And same as like, I'm sure you've played at such a high level. You've worked with strength and conditioning coaches in the past. And if you think about like the stuff that they've given you, it's for a purpose. So it's like specific for the sport you're doing. And so it's making sure that the muscles you need to do what you do are strong enough to do that. And I think as athletes, when you see, especially the younger ones or even, not that young, your body will do what it does in a way that works best for itself. But it's not necessarily the most efficient or the healthiest. And so it might do the thing, but it's not going to do it in the best way. So if you can see, if you notice those things and you can work on them, you can strengthen what doesn't look right, then that can only help them get better at what they're already doing.
Nice. At CANXL, we emphasize developing the whole athlete, physically and mentally. How do you approach holistic development with your athletes who might be on the brink of burnout? Do you have any mental tools or skills you come back to again and again?
I don't know if I have a specific mental tool, but I think the biggest one for me is when I talk to my athletes as individuals is really going back to the root of why they play football to begin with. Like, why do they play? And going to find the most fun way that they do that. I think everyone gets really bogged down in like training and performance and like needing to achieve certain things. But at the end of the day, I think we all just love to play the game. And so whether that's going to play like a pickup thing, whether that's watching something they love, like whatever it is that made them fall in love with the game to begin with, I think getting back to that and thinking about just playing with no stakes is the most important thing because, everyone will train a lot. There's so many people who train at such a high level who do all this. And at the end of the day, the things that we've seen are the burnout ones who never want to play again. And that's what breaks my heart the most because the whole point of it is to play and enjoy it and love it. And so I think that's the one I use the most is if they're really starting to feel the burnout is find a way to get them involved in it, but not any kind of pressure scenario so that they remember why, whether it's, coaching and there's so many different ways you can be involved in it without actively doing as much as they probably are to reach that burnout phase.
Yeah, I love that. It makes me think of the metaphor of like a chef's secret ingredient is love. And for myself as a trainer, my secret ingredient is joy. I always want to bring joy to the sessions. And I think that's because for myself, I've played for such a long time and I never lost that joy. And that's because I had, let's say, my father, who was one of my coaches when I was a young player, and he never was one of those strict, stressful parents that made it not fun. So I like your cues of returning back to joy and why are you doing this? And at the end of the day, it's a game. It's supposed to be fun. And I really do try to emphasize that in my sessions, whether it's through my charisma as a coach and just, my personality, but also making sure that the player isn't feeling like it's a stressful environment. When we are in joy, that's when we're performing the highest too.
Exactly. And like you said, like we all love it. So it's like, it's supposed to be fun. It's a game. And so just remembering that, I think, is the most important part.
Nice. Okay. So we've come to the last question, and this is the one that I asked everyone, and we even have a poll on social media for it. So the question is team training enough to fully develop as a player?
I would say no. When you're team training, you have one coach with however many athletes, and usually the goal is to develop the team as a whole. And so I think depending on what level you're looking to get to, I think having something individual or some like small group, like someone that can really get to know you and your goals, your strengths, your weaknesses is going to help you develop the best. With a lot of the better teams I've seen, a lot of the, there's so many athletes doing individual training or small group training or additional training on the side to develop technique. And what I have seen is there's a big gap in those who take the time to do their individual training compared to those who only do team training. It's a hot take for which if it's enough or not. And it depends. I think it also depends on on the coach and on the team and the club that you play for and what their philosophies are in terms of their training sessions, if that's enough or not for you. But I would say in the vast majority of cases with what I've seen, I don't think it's quite enough.
Yeah, absolutely. And I think your point kind of leads to at least mentorship, or like that extra layer of just like what you do with athletes, like as a chiropractor, you individualize, you specialize into what do they really need, the fine tuning. And players at the end of the day in team training, they might not have that specificity because there's so many players involved and not as many coaches. So getting that support outside, obviously I'm biased, but I agree that, getting those fine details, you can truly see the difference between the players that are doing it and the players that aren't doing it.
And even if it's just a little bit of guidance, and this is where I'm like, if I throw in my artistic background into this, I played professionally in orchestras. When you go to rehearsal, it's a big group and their focus is on making the group sound the best and perform the best. Same thing with a team. It's how does your team perform the best? But as an individual, like how do you get the best out of yourself? You can only do that one-on-one. They're not going to be able to see that in a big group. So it's, or if they can, it's only going to be to an extent. So I think if you're looking for the best possible performance in any capacity, then it's very difficult to get that in a team training environment.
Yes. And I love that you brought this full circle to your music background as well. Nice. Well, Dr. M, thank you for sharing your insights and expertise. Your multidisciplinary approach offers valuable perspectives for trainers and athletes alike. Where can people learn about more from you or get in touch?
You can follow us on Instagram, Fine-Tuned HP, or my coach Instagram is Dr. Coach AM. We have our website as well, www.finetune.hp.ca, and you can shoot me an email, DM me, whatever is easier. If you have any questions, I'd be happy to answer and help out.
Thank you again for highlighting the importance of individualized care and holistic development in athlete performance. We'll see you later.
Thank you. Take care.